I want to take you through a teeny tiny bill called Bill C-64, the very following number after C-63. And I should tell you that the totality of this bill is 10 pages, of which one is just the cover page and 2 are blank. The entire pharmacare bill is just 7 pages, not even 7, because remember, as these laws are written, there's a column on the left in English and a column on the right in French. Grand total, there's just about 3.5 pages in what's called a revolutionary pharmacare bill. I'm going to take you through it now to show you that it's a trick. Anyone who believes that pharmacare is coming to Canada has been lied to by, you guessed it, Justin Trudeau and Jagmeet Singh. So let's jump right into it. The cover is Bill C-64, an act respecting pharmacare. Okay, that's just taken us through 1 out of 10 pages already. The next page is just a summary. Do you see that? I'll read it in full because it's so brief. This enactment sets out the principles that the Minister of Health is to consider when working towards the implementation of National Universal Pharmacare, and provides the minister with the power to make payments in certain circumstances in relation to the coverage of certain prescription drugs and related products. But let me reiterate the most important part there. It sets out principles that the minister should consider when working towards pharmacare. In other words, this actually isn't the pharmacare bill. It's a promise to promise. It's an agreement to agree later. It's saying, you know what? If we ever do get around to pharmacare, here's some ideas that we'd like the minister to take into account. Seriously, they give it away right in the first sentence of the summary. I'll read the second sentence just out of fairness. They say, it also sets out certain powers and obligations of the minister, including in relation to the preparation of a list to inform the development of a national formulary and in relation to the development of a national bulk purchasing strategy, and requires the minister to publish a pan-Canadian strategy regarding the appropriate use of prescription drugs and related products. Yeah, I'm not sure if I trust Theresa Tam or the rest of the gang at Health Canada to tell me what drugs I can and can't take. I think they've forever burnt that trust. And really, I'm not sure if any of this is the federal government's business. As you know, our Constitution, Section 92 and Section 91, they divide up what's a federal power, Section 91, and what's a provincial power, Section 92. Hospitals and healthcare, it's a provincial power. Is this law even constitutional? Well, like I say, it's just things to think about laws, so it doesn't really step on any toes. Finally, I'll just read the last sentence. Finally, it provides for the establishment of a committee of experts to make certain recommendations. So it doesn't have those recommendations, and it doesn't have a committee to make recommendations, but it provides for the establishment of a committee of experts who will then make recommendations that the minister can then take into consideration. I'm not kidding. That's what's in this bill. So we're already done the first few pages. Let's read the rest. I mean, there's really nothing in here, but I want to take you through it so you can say with complete confidence, if anyone ever asks you about the Liberal pharmacare bill, you can say, I read every word of that. It's a baby law. It's a mini law. And there's nothing in there other than a promise to think about something in a committee, appoint a committee that will have recommendations. Like it's a laugh. So now I'm on the official wording of the law, the preamble. So again, this isn't the law itself. These are just sort of clear your throat kind of sounds to say, I'm about to do something important. It's not actually part of the law itself. It's the preamble to the law. Whereas the Government of Canada recognizes that quality healthcare, including access to prescription drugs and related products, is critical to protecting and promoting health and well-being of Canadians. You see what I mean? This isn't the law yet. This is them just thumping their chest and feeling important. Whereas the Government of Canada plays an important role in ensuring that prescription drugs and related products are safe, effective, and of high quality. Yeah, they sort of did the opposite during the lockdowns, didn't they? They banned you from taking ivermectin, even if your doctor prescribed it. Whereas the Government of Canada acknowledges that when Canadians do not have their prescriptions filled for financial reasons, their health may worsen, which can lead to increased use of the healthcare system and increased healthcare costs. Okay, that could be true, but again, you'll see this is just filler. They're saying things that are pretty banal because they don't really have any law they're announcing, so they just want to chat with you a bit. Whereas the Government of Canada recognizes the role of the provinces, territories, and Indigenous peoples in the provision of healthcare, including coverage for prescription drugs and related products, and is committed to collaborating and maintaining partnerships with them to support their efforts to improve the accessibility and affordability of prescription drugs and related products. So right there, they give it away. I mentioned before that Section 91 is federal turf, Section 92 is provincial turf. They're basically saying, this is none of our business. We don't have the right to do any of this, but wink, wink, if we shovel enough money to the provinces, maybe they'll let us set some rules. Whereas the Government of Canada provides, within federal jurisdiction, healthcare services, including coverage for prescription drugs and related products to certain populations, they're basically talking about prisoners and I suppose the Canadian Armed Forces, and there may be some other places, including some Indigenous communities. But basically they're saying we don't have the right to do any of this stuff in 99% of the country. I'll keep going through these preambles because what else is there? There's not a lot more in the law. By the way, we're almost halfway done the law. We haven't gotten to the law part yet. Whereas the Government of Canada recognizes that the Advisory Council on the implementation of national pharmacare, as well as several studies, have recommended establishing universal single-payer public pharmacare in Canada. So they're saying lots of smart people want us to do this. Whereas the Government of Canada is committed to continued collaboration with the provinces, territories, Indigenous people, and other partners, blah, blah, blah. Whereas the government recognizes the importance of modernizing the healthcare system with standardized health data and digital tools, such as electronic prescribing, to support better health outcomes and greater efficiency of the healthcare system. Now, again, this is just blather. These are just high-minded thoughts, but it makes me a little bit nervous about an ArriveCan app-style meddling, privacy-busting digital ID. I mean, that's what this says to me when I hear digital tools. Whereas the Government of Canada is collaborating with the provinces and territories and other partners and stakeholders to support the work of the Canadian Drug Agency. Again, I don't want someone in Ottawa telling me in my city, whether I'm in Calgary, Vancouver, Toronto, or wherever, I don't want someone in Ottawa making up the rules for me, especially if that someone's name is Theresa Tam. And whereas the Government of Canada has launched the National Strategy for Drugs for Rare Diseases to improve the accessibility and affordability of those drugs for Canadians, well, who can be against that? Now, therefore, His Majesty, by and with the advice and consent of the Senate and the House of Commons, enacts as follows. So everything I've read so far was just them, giving themselves an introduction. Let's go through it. We really are halfway through this now, more than halfway through. Short title, this act may be cited as the Pharmacare Act. Definitions. Indigenous peoples, we know what that means. Minister pharmacare means a program that provides coverage of prescription drugs and related products. Pharmaceutical product means a prescription drug or related product that is funded in whole or in part through a pharmacare agreement. All right, so pretty basic. I'm already on page 5 of 10, and remember, the last 2 pages of this law are blank. So we're almost done. Do you get the feeling that maybe the media bought it hook, line, and sinker, that this was a massive agreement? This is what Jagmeet Singh traded away in return for his promise to support Justin Trudeau.